Well, greetings, everyone, and welcome to the EKG case for the week of March 17th, 2014. Before we get actually to this week's case, last week at the end of the case, I put a little teaser on there, kind of an unknown case, to see if anyone could figure out what's going on here. And this awful-looking 12-lead EKG was the actual EKG obtained on a 60-year-old man that presented with abdominal pain. Now, there's no chest pain, but we figured, we have a low threshold to get EKGs on patients that are, say, over 50, 55 or so, presenting with upper abdominal pain. And as this patient sat there complaining of some abdominal pain, this was his real 12-lead EKG. It was repeated. This is it. This is not artifact. This was his real EKG. And I asked folks out there what their ideas were about how this could possibly be happening. Because this, to my eye, this is ventricular fibrillation. Some people looked at this strip and said, well, that's polymorphic VTAC. But whether you look at lead 2 and call it VFib, or lead V1 and call it polymorphic VTAC, this is not a well-perfusing rhythm if it perfuses at all. There's no way that a person with this rhythm should be sitting there saying, I'm having abdominal pain. This person should be unconscious, getting prepped for a defibrillation, right? But this is really his 12-lead EKG. Now, in reality, a few people out there did actually get the diagnosis here. In reality, any of you who would be taking care of this patient would know exactly what was going on. Clinically, this is pretty simple, because as you look at this patient and talk to him a little bit, what you would end up seeing on this patient is a left ventricular assist device. This patient had an LVAD, and I didn't want to tell you that, but this was his real EKG rhythm. He was in VFib or polymorphic VTAC, and the only reason this guy is alive and perfusing and doing pretty well is because he has a left ventricular assist device. So kind of an interesting and certainly a bizarre case, but I think we're going to be seeing more and more of this type of thing. Bizarre rhythms in patients that have LVADs that are completely awake and alert and are doing pretty well. LVADs are becoming more and more common, not only at tertiary care centers, but out in the